So one thing is men were stigmatized. But if I got syphilis, went to the hospital, I'll be branded immoral. That's one.
When a man has a challenge with, for example, sexual, around the sexual performance, and he goes to his friends, everybody's a stud, right? Yeah. Everybody tells him, you have I go 3 hours. Why are you like 2 minutes? Indomie. What's the problem? Right? Everybody's a stud. That's not true.
Yeah.
Right?
Yeah.
Yes. And we realize it. So because of peer pressure on how men would shame you, or how men make you feel inadequate, you would rather a platform that allows you to engage anonymously and nobody will judge you.
Yeah. Everybody looks at therapy with a positive outlook.
Yeah.
Like it's beneficial to the culture rather than do we need to tinker with therapy to fit in masculinity. Rather, the question should be, should we have a conversation about engaging our cultural practices and belief system? Are we able to develop a culture in which therapy is seen as something that any man can access without people saying, even the gossip bit of it, that maybe Dennis goes to therapy, you see? Can we develop a mindful culture in which everybody looks at therapy with a positive outlook?
Welcome to the Med Squad podcast. We ask the question, what is a man? Is it someone who uses sandpaper instead of tissue? Is it someone who eats sugarcane with everything, including the skin? Well, today we're going to talk about a topic that affects all men, and by extension, the family and the community. We're talking about men's health and why men avoid it despite eating sugarcane. And I have some brave men here who are going to introduce themselves and say to their chest, because apparently that's what men are expected to do. Introduce yourself, please.
Dennis Mandere, head therapist at Zuri Health.
You're a man.
And I'm a man.
Now you have to put in some graphics.
Ike Chukwuasanoke, see you at Zuri Health. And I'm a man.
Yes.
Anthony Ndegwa, general medical practitioner at Zuri Health, and I am a man.
Yes. Now, as we talk about men and this mask of strength. So you say, people assume you're a man, but at the same time, we have this avoidance of our own health. So what is the average life expectancy? Just to ask, the life expectancy gap between men and women, there's a difference. Which one? What is it? What officially is that gap?
5 to 7 years?
5 to 7 years. Who lives longer?
Women, of course.
Women. Yeah. They do live longer because they peel their sugar cane. So then
and they use tissue paper.
Yeah, they use tissue.
They don't use sandpaper.
Sandpaper or poison ivy. So why are men so reluctant to seek care, even when it's available and it's necessary?
Well, there's a variety of factors to include when you're looking in that perspective. But especially in the African context, the largest one is the cultural aspect, where men try to view going to a hospital as a sign of weakness. There is that perception of, there's a dominant notion of a man is not supposed to portray weakness. We have behaviors and cultural practices that lead to men not being able to access medical centers and facilities and what have you. We have a lack of education, especially in topics such as sex education. We have a lack of it here in Africa. There are other factors such as location, accessibility of care for men, which usually play a part. But going back to the cultural aspect, we have a behavior where men diminish when symptoms occur to them, they kind of diminish the impact of those particular symptoms. And they say, maybe it's a passing event. Okay. Then there are issues such as non-adherence to nurturing behavior such that push men towards accessing care.
What do you mean by nurturing behavior?
In Africa, we have a rationalization of the non-adherence to health-seeking behaviors. What do I mean by this? For instance, if someone was to come with a HIV kit, or you are seated here, and he was to say, who will be open enough to having their HIV status checked. Most of the time, you'll find someone making a a comment that might desensitize you in terms of wanting to seek to know your status. And that's what I'm talking about there.
Okay.
Non-adherence to medical seeking behavior.
Yeah.
Yeah.
All right. So, Anthony, when these men finally man up, or at least get the courage, and they come to you, what usually brings them?
Okay, thank you very much. So, as he said, that men will tend to wait until things get complex. And this can be seen even from the ancient. Let me give you an example. So earlier, there is a saying that one night with Venus, lifestyle with Mercury. What does it mean?
Yeah.
It means that earlier there were diseases like syphilis.
Yeah.
Then it was called the French disease, where women, they could have intercourse with men. And when men contacted syphilis, they call it the French disease. In a time you went to the hospital and you were diagnosed with the French disease, it was automatically that you got it through immorality. And that's why it was coined one night with Venus and lifestyle with Mercury. Mercury was the main treatment for syphilis. It was both toxic and non-infective.
Whose idea was it to use mercury?
So the then science was, mercury was the main mode of treatment. So you could apply to the sores. Remember, it was their wounds. So you apply mercury, and you know how mercury is toxic. So one thing is men were stigmatized. But if I got syphilis, went to the hospital, I'll be branded immoral. That's one. Two, they thought that the treatment was also wrong. And this is one of the background stories that tell us the health-seeking behavior of men.
So even the gossip really deters men from seeking help.
Yes. Okay, firstly. So mostly men will come, the leading causes of hospital visits are linked to pain, bleeding. Okay? But most men, even with those, they're likely not to come. So most of them will first try to self-medicate at home or even ignore. As we said, it's probably a temporary event. So they will come when, number one, the condition is life-threatening. Number two, when now they see the self-medication is not working. We're talking of more severe issues. Number three, they will come because of no peer pressure. The wife has said, now you cannot sleep in this house unless you go to the hospital. So these are some of the things that will make them to come to the hospital.
It's actually like a perfect example for a condition like TB, right?
Yeah.
TB. Yeah, because TB you might dismiss it as being, it's just a cough.
Yes.
It's just a cough.
And she says, you're not going to cough one more time in this house.
So until that time when you cough and you see blood and you're like, my lungs will pop out.
And even then, they're stubborn. But for you see, men also, this image that we have, we don't want to be seen to be weak. But in the digital space, do they interact differently with the health tools that are available? They are virtual tools?
Yes, they do. Because again, it's anonymous and it gives them an opportunity to express themselves without peer pressure. I'll give you an example. When a man has a challenge with, for example, sexual, around the sexual performance, and he goes to his friends, everybody's a stud, right? Everybody tells him, you have me, I go 3 hours. Why are you like 2 minutes? Indomie. What's the problem? Right? Everybody's a stud. That's not true. Right?
Yes.
And we realize it. So because of peer pressure on how men would shame you or how men will make you feel inadequate, you would rather a platform that allows you to engage anonymously and nobody will judge you. That's one. Secondly is the way we've designed health at Zuri Health. Now, I'll give you a reason why. You see, when we decided to build at Zuri Health, I've sold things in my life. I've sold music, I've sold ringtones, I've sold everything. And health was the hardest to sell. Harder to sell to men. My friends were very difficult. I know you're hypertensive, George. You do, no, I don't want to check. If I check, I must see something. So one thing must kill a man. No, I'm not going to do it. Right? And it was very difficult. Then we went back in to do some research and we figured out that there were psychological factors around why men do not seek healthcare. Number one is what I tend to call mommy doc factor.
Mommy doc factor.
Yes.
Okay.
Now, when a male child, a boy is sick, who does he go to?
Mom.
His mom. Right?
Yes.
Sure.
And when a man is sick, the first person to know is his mom. He calls his mom.
Yeah.
Right? So we figured that because of the mommy dog factor, that for you to design health systems, build it around women. They tend to function better. We decided to do something else and do health, to design our healthcare process around women.
Yeah.
So it's easier for me to get a man to do his wellness when I get his wife. So when I get a wife to do a wellness, he drags the man along.
Okay.
Right? And that has helped men access health. So one is the anonymity of the digital tools, which makes it easier for me to go and where nobody will judge me and ask questions, where I know nobody's putting up pretenses with my boys. Everybody's saying, oh, I'm a champion and all that. I'm able to use the digital tool to ask for help and be vulnerable where no one can see me. Two is I have a wife or a partner or a mother who will push me to access health, right? Which is the fact that, like we've mentioned it, the wife will say, if you cough again in this house, right, you're not going to see her go to the hospital. Or you find a doctor in the house. Or she drags you to the hospital. Now, designing healthcare systems around leveraging the power of women as the chief medical managers of a home tends to push men into seeking health. So when we do annual checks for women, they drag their husbands. Right? And that is what we've seen to be very effective.
All right. So now when we come back, if in spite of all this, you're still stubborn, we're going to look at the cost of delay right here on the Med Squad podcast. Stick around. Hey there. Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose for energy, for recovery, and for lifelong health.
They are not just lab coats, you are detectives, and your blood speaks and it translates.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the Men Squad podcast. Okay, Med Squad podcast. We have to keep the branding consistent. But I'm actually going to ask a bit of trivia as we discuss with our men here. Tishra Demitz from Ike and Anthony. And I'm Yafesi. Hi so much. So at what age should men start regular prostate screenings?
Okay.
And,
So first things first, all men, they have a prostate. Unless we removed it because of one thing or another, or probably you had a congenital problem that you are not born with. Okay? So when all factors are constant, every man should start checking theirs. The guidelines say 45 and above, but with the kind of lifestyle we have today, we advocate even 40. And there are multiple ways to screen for a prostate. We have the examination one that we don't want, that people don't want.
Yeah, that is the scare.
The pointing
pointing
in the right direction.
in the right
direction.
Yes. So that is one.
Oh, that's hard.
Okay? But because we don't want to do that, we have other options. The other option is the prostate-specific antigen, where we are going to do a blood test on you. Or we can even have ultrasounds. They can also help us to some level. Remember, it is screening. It is not diagnostic. We can still use that.
Yeah. Okay. So what are
Do,
the
do you feel like if it was done by men, mostly men practitioners, it will be more comfortable?
It'll be worse.
be worse?
You think so?
It'll be worse.
Yeah, I tell you
Absolutely
to get
worse.
this behind me, and they're like, no, wait,
No,
take
yeah,
that back.
no.
Don't go anywhere near me.
The only person who should get behind you is Satan.
Exactly.
So there was this radio program in Lagos, and a doctor was talking about, post-rates.
Mhm.
And when a lot of men, he had some, some checks, and they told them that, if you don't remove your prostrate, right, then you could advance to prostate cancer. And they said, what were the, the side effects? And they said it might affect your erection. All of them declined. One team was kilema, right? If it's going to affect that performance, absolutely not, right? And again,
So I'd rather go down fighting.
yes. So, again, things that we need to deal with, that it doesn't get to that.
Yeah.
How do we do that? I remember my groups and, say, hey guys, it's the beginning of the year, right? We must, do full wellnesses. And since we're all above 40 here, we must do the prostate examination. And everybody says no.
Yeah.
Yeah, no, nobody is touching there. Absolutely not. Something is not supposed to go in there, it's supposed to come out. And you see, the challenges with this is that a lot of men are predisposed to having prostate cancer.
Yes, true.
Black men at certain ages. And it is one of those avoidable cancers that when you do regular screening and checks, it could be identified and dealt with.
Yes.
So we need to do storytelling as a way of talking to those men. So tell them stories about men with prostate cancer. Tell them about what happened. And some of them will say, okay, is there another way? And like what Anthony was talking about, you could do a PSA test.
Yeah.
But I always advise, a doctor always says that this one is a very important one that you should try, once a year.
Yeah. So how do the emotions affect our health? Because there's some men who will pretend that they're siding with the group because they don't want to be singled out. But then now in their small corner, like, okay, so how do emotions affect men's health?
First of all, before you answer that, I'll say every emotion is valid. It only depends on the context. For instance, take something as basic as anger or fear. There is a context in which you're allowed to apply anger or fear.
Yeah.
Okay? So the problem is when you apply the wrong emotion to a particular scenario.
Yeah.
Say conditions such as neuroticism. Neuroticism is where someone is always aggressive, always angry, and such and such. So when we see people who have presenting with such a condition, especially those emotions, they usually present with blood sugar, which is way off the mark. They have hypertension, they have chronic diseases and such. In the reverse, when you have a positive outlook in terms of how you engage with the emotions, you have lower blood sugar, you tend to seek more healthy behaviors. Your weight level is constant to your BMI index as it presents. You have better outlook in terms of how you portray yourself in life. Yeah.
Okay.
Yep.
And yes, to add on the same, there are some aspects of our life that we don't think are important and are connected to diseases. You see, for example, in the latest discoveries about the lifestyle modification for management of chronic diseases, including mental health, we are talking of social connectedness. It is one of the aspects. Initially, we were just talking about stress management, nutrition, and exercise. Today, the feeling of belonging as a man affects your blood pressure regulation and your sugar control. So it's more hormonal than you think, it's more social than you think, it's more physical than you think, it's more mental than you think. So we have to approach these things in very various directions.
Yeah,
and talking of storytelling, we have to tell a story today about prostate. Because that is the one risk factor we all have. The fact that you have a prostate, it is a risk factor for you.
Yes.
So we have to talk about how, before you take that blood test, what are some of the signs and symptoms that can tell you your prostate should be pointed in the right direction.
That digital, there was a time when there was an outbreak of, we were told there's an outbreak of yellow fever. And so this was at the border. Everyone was told you have to have the certificate. If not, everyone go get the injection now. We were trying to tell them, okay, it doesn't have a 10-day kind of window. They're like, no, go get it now. And they went to, because I was in a hurry. I had to catch a bus. There was a huge crowd of men. And I was like, I won't make it in time because of this line. I was told, no, this is not a line. Go. There was no line. Went through. All these truck drivers, bus drivers were scared of the needle. They were scared of an injection.
You just want yourself there.
Yeah. So now what is this? The role of fear. There's silence, but then the role of fear in that silence. How does it impact us?
So the fear.
Yes.
And again, that's one of the reasons why in building our healthcare systems or digital healthcare system, mental health is inbuilt in it because it helps, from a tech perspective. Mental health support is important to help you, process, whatever the challenges are. If it's a difficult diagnosis, help you process it. And that is a very important aspect of our healthcare design at Zuri Health, making sure that mental health support, emotional support is important as you're driving people into, constant checks.
Yeah. So now we keep talking about toxic masculinity. It's a phrase that keeps coming up. But when we come back on the Med Squad podcast, we'll be talking about building a new model of masculinity. Is it or ow? Stick around. Welcome back to the Med Squad podcast as we build with the men. One man. And another man, and another man, and another man, talking about building a new type of masculinity. And I start by just a small trivia quiz. Which African country has the most or has the highest men's health screening participant rate? Percentage of men screening. Which one do you think is the highest?
So in Africa, the research is varied. We have different diseases. So for example, in prostate issues, we're looking at Cameroon being among the top. You see, they are not conclusive studies. You go to Nigeria, you're thinking more of hypertension screening rather than prostate issues. You come to Kenya. Yes, we are trying to create awareness. Even we have a working guideline, but the screening is not topmost. So the research is neither here, but you're looking at issues like, for example, South Africa, issues of HIV. They are doing way better in terms of men screening. So the research they are varied on different diseases. Yes.
So for you, what works when talking to men about their health in your experience?
Okay. First, it is to demystify myths and creating awareness. And I've always told you that education is the only thing. First, we are dealing with ignorance.
Yeah.
Before you criminalize people, you people don't want to seek your help. It's an issue of, first of all, let's cure ignorance. Because there are people who know the benefits of early screening, but they just don't want to do it. But others, they don't have the information. But with the modern world, social media and technology, people are getting to know more about why they should screen, but sometimes they tend not to go.
So, Dennis, how does therapy look, or can it be made more masculine friendly in the traditional sense? I don't know if that means put Nyamchom on the side and have PlayStation in the room. But what does it look like to make therapy more masculine friendly?
Well, I don't think we can make therapy anything rather than what it is, to be honest, because therapy is client-centered. The patient presenting in front of you is the one who is supposed to direct how the engagement is supposed to look like. Rather, the question should be, should we have a conversation about engaging our cultural practices and belief system? Are we able to develop a culture in which therapy is seen as something that any man can access without people saying, even the gossip bit of it, that maybe Dennis goes to therapy, you see. Can we develop a mindful culture in which everybody and therapy has everybody looks at therapy with a positive outlook? Like it's beneficial to the culture, rather than do we need to tinker with therapy to fit in masculinity?
Okay.
Yeah.
So like, is that how Zuri is creating you mentioned, of course, focusing on the women, but if that is put out there, sometimes I might be like, I don't want to interact with it. Let the lady interact and then come to me. So how does the platform?
No, I think when I say, build healthcare designs about women is just really about consumption, or who, a pull effect to drag their spouses, their sons to access health. But when you look at the design around digital health, especially screening and whatever are the tools, it helps solve a challenge that men have, which is ability to communicate anonymously with somebody bereft of judgment, trust, confidentiality, bereft of judgment, that you're free because the person doesn't really know you, right? To do that. And that is a very important aspect of trying to get men to be able to do this.
Okay, so the trust element is built into the anonymity is
built into the product design.
Ease of access. Hey, okay.
For a man to open up, he really needs to trust you and to be confident in, I will present with you this information and I don't feel like it will be used or weaponized against me in the near future.
Miss. Yeah. My goodness. Now, it does sound like we really work hard to put up a facade of courage and strength, and yet we just need love and care and nurturing. So as we close, there's one last, I don't know whether to call it a challenge for each of you. Like, do you personally have one message that you feel each man needs to hear? Apart from there's food in the corner there and drinks at the back.
I think that we need to take our health seriously.
Yeah.
And we need to be our brother's keeper. We need to be very real with ourselves, because the idea that when men sit together to discuss healthcare issues, they're not vulnerable about their health. And it's not just about sexual health. It's about the fact that every man is okay, optimal. Nobody says I have high blood pressure, I'm diabetic, or I have this. Unlike when women sit and talk about the challenges about their health. So I think we need to be a bit more vulnerable with men, right? Amongst ourselves. And that we need to have more of these conversations with men and storytell around what are the challenges around not disclosing, not checking, and most importantly, avoiding seeking healthcare.
And I'll say most of the conditions that present in men, 52% of them are preventable.
Yeah.
Prevention is way cheaper than cure. And it is okay not to be okay. It is okay not to be okay. Yeah.
It's okay to also talk about not being okay.
Yeah.
Yeah, first.
Yes.
Talking of toxic masculinity, you cannot be toxic against prostate cancer. You can only be toxic against your wife, your children, and your friends.
Yes.
But not against hypertension, not against diabetes.
Yes.
The leading cause of men is ischemic heart diseases. Heart diseases. We're talking of heart attacks.
Yeah.
This happens even to men in the gym.
Yeah.
The one taking steroids.
Yes.
Okay? It cuts across. So we cannot be toxic against diseases.
Yeah. Hey, that makes a lot of sense.
So let us screen. And we're going to screen from now for our prostate. So these are some of the signs and symptoms of prostate. So before your prostate becomes so big and you are diagnosed with cancer and all those things, there are some of the symptoms. You say that your body will always speak to you. Number one, it is urination. So the frequency of your urination can be affected by UTIs, kidney stones, but again, be checked so that we know what is causing you to pee frequently. That's one. Two, it is weak stream. You go to the toilet. Every man has tried to urinate while erect. You have to strain. You are forcing the urine. So somebody with a prostate issue is likely to experience the same, even when their manhood is not erect. That is straining. You're looking of urgency, meaning a man, you feel the urge to urinate. Before you get to the toilet, Everything is out.
Yeah.
That is not incontinence. That is urgency. That is where you will enter a matatu or public a transport system. There are no children, but they smell of urine. And then you think, this man is not clean. It's urinary urgency. Okay? Then there is another one called dribbling. So you go to urinate.
Yeah.
You finish.
Yes.
And you shake well after use. You put the manhood in there. And when you're walking back to the office,
There's
still dribbling.
Hydrating.
Okay? So these are some of the symptoms. They can be associated with other conditions, but that is why we are asking you to screen. The other one is now complete blockage. The urine is not coming out. And then you'll hear people saying they will put a catheter and all those things. So these are some of the symptoms alongside issues of now sexual performance, erectile dysfunction, and all that, these problems. So that is why screening is very important for us. And finally, you cannot provide for your family when you're sick. So if you have hypertension, just handle the hypertension and then you'll find the time and the energy to work for your family and provide and be a man.
Yes.
A man is not a man when they are sick. A man has to be healthy. I think that is should be the first definition of manhood, healthy.
Hey, is there another phrase we can use to replace the word man up?
Health up.
Health up.
Health up. Health up. Health up. Okay. And then I was just out of ugali rice or plantain. Which one?
Plantain. Come on.
Eh?
Gali.
Ugali.
Yeah.
It's meat. For me, it's meat. I'm not taking carbs.
Plantain, man.
You see, these are things we're trying to help you. Anyway,
Sugar will interfere with my...
even plantain. Okay. Fine.
With these flag
I
rates.
have trust issues with people who don't like plantain.
Yeah. I mean,
How can you not like plantain? I don't
So
trust.
I feel like in Kenya we don't prepare it as good as maybe the Ugandans.
It's just plantain. You're facing. You say I don't relate with cousins to bananas and
and on that bombshell, we come to the end and give you homework. Go check. Everyone should check their prostate.
Yes.
Have their prostate checked. Go for screening and check your blood pressure
yes, and
Check.
blood sugar.
and your blood sugar.
When they remove the blood,
Yes.
check two things: the prostate-specific antigen and the blood sugar.
Yes.
Yes.
Please do that. Book that consultation now, today. Let's book it through Zuri Health. Why not? Go ahead and do the shameless plug. Yeah, I'm very shameless. But just talk to someone because men's health is actually the nation's health.
Yes.
And so it's not just about paying bills. It's about being responsible with your body and your health. My name is Yafesi and the men right here on the Men Squad. Well, it's the Med Squad podcast. Follow us on all the handles at the Med Squad Pod. We say thank you.
Thank you.
Share this episode and see you next time.